Good afternoon, friends. Team Hitcon invites you for one more interesting talk on this subject, that is Hitcon Hit Talk. As you all know, Hitcon is an initiative to promote use of technology among doctors and to make doctors and healthcare professionals aware about the latest in the field of technology in healthcare. We know every day exciting things are happening around us, and it is difficult to keep track of everything that is going around. So we have decided this a series of Hit Talks wherein we invite some technocrat doctors and technocrats who are expert in their field, who are possessing expert interest as well as some interesting knowledge in that particular field. So today we are here with one more topic that is more pertaining to anesthesiologists, and we are fortunate to have Indian Society of Anaesthesiologists, that is ISA Gujarat State Branch, joining hands with us in disseminating this important knowledge and information among the healthcare professionals of India. So I thank you, Dr. Atul Gandhi, for lending support to Hitcon in organizing this. Thank you, Dr. Gandhi. We have with us an eminent speaker, Dr. Tushar Chokshi. Dr. Gandhi will introduce him. Dr. Atul Gandhi is a well-known figure to the anesthesiologist of Gujarat. He is right now the president of Gujarat State Branch of ISA, and he is also the trustee of Spurs Foundation, and he is very actively involved. And we were just talking about various initiatives that he is taking about promoting and teaching people the basic CPR, which is the most vital thing and most essential thing that every layman should know. So without much ado, I will hand over this mic to Dr. Atul Gandhi. Dr. Atul Gandhi will introduce Dr. Tushar Chokshi, and then we'll start with the program. Dr. Atul Gandhi, welcome.
Thank you, Dr. Preanesthetic. Such a nice initiative. Basically, the day-to-day technology is more powerful. So nowadays, we are going to the artificial intelligence. So this topic is too much for anesthesiologists. Doctor, I have no words for Dr. Tushar Chokshi. He's our IT great. Basically, Gujarati માં કહું ને તો અમારા ગુજરાતનો even diamond hero છે IT technology નો. He is an editorial group member of IGA. He is consultant private practice anesthesiologist since 32 years in Vadodara and attached various hospitals. He delivered more than 200 webinars, lectures during COVID period and then later on, and also the more than 150 conference lectures. Also, he had done such a superb work in infographic. That is a unique, basically there is a handy book, the infographic of all anesthesia, medical words, some disease also. So this infographic is really such innovative from the Dr. Tushar Chokshi, and he's a founder member of TIVA and OFA Facebook group in India. So without wasting time, I invite Metaverse anesthesiologist Dr. Tushar Chokshi.
Thank you, Dr. Atul. I am very much thankful to Dr. Atul and Dr. Preanesthetic, who is a pioneer in Hitcon. Our Hitcon is an offline and online conference, and I had given so many lectures in Hitcon conference physically also. So basically, this is my dream, where in this platform, I am the first time giving these lectures, and I am very happy to deliver this lecture to my anesthesiologist friend and those who are hearing on the YouTube channel. So thank you. Just a minute, my slides will. Can you see my slides? Second slide?
Yes, sir. Yes, sir.
Yes.
Now I will start my lectures, which is only 20-25 minutes. So here is my dream, future anesthesia workstation in 2030, and how it will works with the technology and what anesthesiologists will be boon for and benefited with this type of the machines. If you see the invention of this anesthesia machine, it is since last 200 years. First anesthesia small machine ether inhaler was introduced by in 1846. Since then it was changed and changed and changed, and today it is called as a anesthesia workstation from anesthesia machine. So anesthesia workstation have come a long way since their inception, and they are crucial tools used by the anesthesiologist to administer safe and effective anesthesia to patient during any surgical procedure. Before that, there were no exact mapping and dosing of the anesthesia drugs and inhalation agent. And after this coming this type of the workstation, it is very precise. These workstations have undergone significant advancement in recent years with the integration of modern technologies such as electronic patient monitoring system, gas analysis system, and automated drug delivery system. So in these machines, we will found everything, whatever you want with the safety features, and it will save the patients and it will save the doctors, anesthesiologists time also. However, the future of anesthesia workstation is expected to bring even more advanced features and capability that will further enhance patient safety, comfort, and clinical outcome integration with the artificial intelligence, metaverse, and machine learning algorithm. So these three things which is going in the world very prominently nowadays, that is artificial intelligence, metaverse, and machine learning. If they are integrated in this type of the workstation, then how it will be? So in future, it will reduce the workload of the anesthesiologist and it will enhance the patient experience also. Believe me, after coming this type of the machine, it is very, very rare to even kill the patient with the anesthesia drugs. And it will be a dream of my project. So if you see these pictures, then how these machines were changed. Initially, it was like this, and then it has come with the small boil separators. And when we were studying in 1990, then we were studying in this type of the machines, which have a oxygen and nitrous cylinders, and then vaporizers, and then flow meters and everything. Then the anesthesia machine was changed, and it has came with the ventilator, then closed circuits and carbon dioxide absorbers and everything. So now it is changing and changing every 10 years. And we got a complete workstation with all integrators safety features in 2000, just 20 years back. And these are the parts in modern machines where ventilatory settings and ventilatory parameters and monitors, vaporizers, all type of vaporizer mounted in one bag, absorber system, CO2 absorber canister, all type of alarm, medical gas pressure, how the oxygen is supplied and what goes it. So they have O2 flush button, and there are all the facilities where you can have. And this machine to learn in education in anesthesia curriculum, it is a very difficult to sometimes in the junior part also. But now, day by day, it becomes very easy. And nowadays, all anesthesiologists are working this type of the machine. And these are the things which came after that. And they have integrated the even multi-para monitor in these machines with all the features of, there are so many features added. And there are 22 companies in the world, leading company, anesthesia company, which they are producing this type of the anesthesia workstation. And this is our latest machine, which is available in all over world. And even in India, even in Gujarat and Vadodara, where I am working with this type of the instrument. So our journey started from the Boyle's machine. It was invented fully anesthesia machines by the Boyles. So it is called Boyle's machine. And this is the today's advanced anesthesia workstation. And in this, just put a patient on tube and connect it, and you will be surprised that everything will be adjusted. And this is the global market of the anesthesia machines. Market are going in the every year with 11% growth. And you won't believe that around 1.6 lakhs crore rupees started in 2022 for the anesthesia working station. And their expectation in research and market is that around 2.4 lakh crore rupees will be the business in 2026. Even in India is not far behind. It is in India, there are more than 16,000 crore rupees is a business in 2022 done, and it expected by 2026 it is 26,000 crore rupees of the business with the anesthesia working station only. India is having around 11% market share because we have more than 1 lakh anesthesiologists around the world, and probably it is the highest after China. And if you see how the anesthesia market share started and where it is used, so they are used by hospitals, point of care places, and others like NORA situation, MRI suits, and sometimes in the cardiac cath lab, gastrointestinal suits. Everywhere these machines are needed. So according to market survey, there are more than 2.6 million working anesthesia workstations are in the world till 2022. Remember, 26 lakhs, and it will be expected that demand will be more than 2.2 lakhs machine in the world by 2026. So you see that how much the business is going on and how much the safety part is going on in this machine. And today's ideal anesthesia workstation or machines are included. How it works? Anesthesia machines offer diverse technology, smart software applications, helpful features, and decision support tools with superior flexibility, standard ergonomic designs, and user-friendly operation. You can move with your only from one person, which can be given, which can be moved from one theater to another theater or one place to another place. So it is not heavy also. This lets you configure the anesthesia workplace customized to your needs. Everybody can adjust on their own demand and on their own like this anesthesia workstation. And combined with patients monitoring solution, this innovative solution brings patient-related data to the point of care and ICU quality ventilation therapy in the OR. You have seen that ICU ventilators, how they work. The same type of the ventilators now added to our anesthesia workstation. So there are such lung protective mechanism, and minimal and low flow anesthesia are very much as they say. And anesthesiologists are working very easily and more efficiently with this type of the machines. What are the safety features in today's machine? There are flow meters, monitoring, fresh gas delivery, alarm systems, scavenging system, vaporizers, and as well as cylinders, alarms also there. So everything which is connected with anesthesia working station, if it is malfunction, then you will get an alarm. So how it is safe, you can see that. So now you have seen that today's machine, how it is. So my dream now, how it will be in 2030, my machine will be limited size with 5 feet height, 3 feet width, and 3 feet length. And so it is a compact machine, future anesthesia workstation size. And it has got a rubber and plastic casters. So only one anesthesia workstation will work for the everything, like working space of MRI, or working space of space situation, or working space of any NORA situation, or inside the OT or outside the OT. So this type of the machine with caster can be gone totally made up of without metals. It will be totally made up of thick, toughened glass cabinet, and so we can see all parts of the machine from outside. All parts will be seen, and whatever the parts are malfunction, we can remove it and replace it. So you know that in our smartphone technology is now also transparent phones are available with all the things we can see from inside or outside. And today, the anesthesia workstations are so many buttons to start the anesthesia, like for ventilator is different, for another thing is different. There are so many knobs. So here, my dream is only one screen touch knob in front of the workstation, which works as a on and off anesthesia. If it is switched on, then it goes in the asleep mode, and patient will start anesthesia when it is connected with the IV line and when it is connected with the endotracheal tube. And when the surgery is over, then you just put a patient on awake mode. That is the switch will be in the awake mode. Then immediately within fraction of the seconds, all the agents will be stopped, and patient will come out in how many minutes or in how many seconds. That will be told by the machines only. And of course, today's technology, which includes by This machine will be Wi-Fi, Bluetooth, artificial intelligence, metaverse, and USB drive facility. All facilities will be there. So you won't believe that even this machine can be operated by distance anesthesiologist. Suppose if I am in India and my best friend Dr. Paul Zilberman, who is hearing this lecture, is in Israel, so I can adjust his theater's machine from my side, means from my smartphone. Because it includes artificial intelligence, Wi-Fi, Bluetooth, and metaverse. And you can see you have a monitors also, so you can put your USB drive and you can have all the things you can see inside this monitor instead of all other things. Working station will be operated through the remote control and smartphone control. Now, whatever the electronic gadgets are available in the world, whether it is a air conditions or whether it is a major things or whatever the machinery, they are controlled by the smartphone and remote control. So why not my machine will not be controlled by this? So in future, you can operate your machine without touching this my anesthesia working station just by from you have to download the app from that company and it will work. Everything will come on this this phone, smartphone, and like whenever you drive your car, then you can start your car from your home into your garage or into your parking space, and car will start. And you can adjust the AC also. So same technology is available today. So my dream is that that technology will be available in our anesthesia working stations also. So anesthesiologists will be more friendly user with this type of the machine. Even you do not have to worry about the drugs, how drugs will be given to this patient, because all the different tanks are available. Means we are using different tank drugs like preanesthetic drugs, induction agent drugs, muscle relaxants and adjuvants. So all these tanks of 50 ml or 100 ml will be there. You can see which drugs are there. They will be having a specific drug, that how it works. And believe me, we have invented the closed anesthesia loop system. So the machine will decide by artificial intelligence that which drug is to be given after which drug. Suppose it has started a propofol, then according to height, weight, sex, operation time, operation name, and who is the anesthesiologist, according to this drug will be given in the patient's body by connecting these IV lines from the anesthesia machines. And what you required, even the blood pressure falls or pulse rate goes down, then again the other agent will be injected to complete the simple normal vital parameters. So this type of the facilities will be available, and it has started also. Now we can see now our today's anesthesia workstation that we are mounting our oxygen cylinder, nitrous cylinder, and other things outside the cylinder. But they have facility of inbuilt oxygen, air, xenon, and nitrous cylinder and cabinet, and they will be on the back side of these machines. And only one tube for all gas supply. Means there is a hollow tube and all the gas pipeline will go from that hollow tube. So you do not have like a cords around the machines or cords around the this patient's OT table or something like that. And we have seen in today's machine also that there are two parameters or two monitors or three monitors. Like multi-para monitor is different, ventilator monitor different, and other means total control anesthesia monitors are alike, means different. So they are integrated in only one screen only. So only one screen for ventilator, monitor, and other gadget with the one knob only, and it will start on showing on the glass, means a toughened glass screen, that how just feather touch and you will have functions. Even our target control infusion machines and vaporizer will be mounted in the machines only. Today, all the anesthesia workstations are coming with the mounted anesthesia vaporizers. And my dream again will be this anesthesia machine will have mounted total control and target control infusion pump also. So only one vaporizer for all volatile agent and only one TCI pump for all TIVA drugs. See here, today, if I want to give isoflurane anesthetic inhalation agent, then we have a different vaporizer. If I want to give sevoflurane, then it is a different vaporizer. So both these vaporizers are mounted in the anesthesia working station. So what happens? See, this is my future artificial intelligence anesthesia vaporizer. In this, there is only one vaporizer, and it contains only one for choice to select any inhalation agent during anesthesia. There are tanks, 3 or 4 different tanks for different agent, like sevoflurane, isoflurane, or desflurane, and it includes separate tanks for all these agents. It is run by the artificial intelligence. It is feather touch LED light will be available with separate off and on button. It can be mounted in any anesthesia workstation in the world. It is a standard technology. Independent malfunction alarm. Even it malfunctions in the anesthesia trolley or machines, then also it gives its own alarm. Bluetooth facility to be operated through the smartphone. Even this smartphone will operate these vaporizers also. Facility for filling of removal of inhalation agent with the separate pods. And these are the TCI pumps in the invented in the just now also invented in the world with Aliwell model. That see, before their target control infusion pump are available for the different drugs, like for propofol we have a different TCI pump. For remifentanil we have a different pump. But nowadays this only one pump is available for all the drugs. All the softwares are included in these machines, and it will be mounted in this pump. This mounted in the anesthesia working station. And this is also my dream that oxygen concentrator will be inbuilt in case of oxygen failure supply. But believe me, I am dreaming further for that. These oxygen concentrator have gone so much tremendous changes in the corona period that they are coming with the very small models, and just now they are supplying 12 liters of the oxygen per liter per minute. And my dream is that what we require more than 70 liters per minute, that will be also done by the oxygen concentrator. So in future there should not be any dedicated line for the oxygen supply from the outside or from the central supply. Machine will take its own oxygen from the this tank, this type of the concentrator only. And one master reset button for factory setting, like we have in smartphone. Whatever the functions are malfunctions or whatever things are going bad with when you think that it will go, this machine is not working well, then there is a reset button for the factory setting, and you can have all the parameters in this normal. Even you can operate this machine by verbal command, like we are having a Alexa, Siri, Bixby, and it will work in the any languages. Suppose you are in the Gujarat state, and if I am giving verbal command to Gujarati language, then also it will work in Gujarati language or in English language also. You can have setting also like smartphone. And in emergency, if you want to contact your colleague, distant colleague or whatever, then phone dialing facilities will be having in emergency situation. Like SIM card can be integrated. SIM card we can have like eSIM, or a SIM card will be integrated in this type of the machine, and totally feather touch, user friendly. If this will tell you the further steps that how it will be working. It will be compatible with the MRI, because in MRI we do not want any metal things from these our machines. So this machine will be having a totally made up of glass and plastics only, which is very compatible with the MRI and PET situation. And even in space, see, there are 3-4 incidents has happened to give anesthesia in the space situation in the world last year only. So easily serviceable with all machine parts. In this glass cabinet machine, you can remove any parts easily, because it is just mounted and you can repair it. And of course, if you have you are very much aware of that, your smartphone or any electronic gadgets are running with the batteries, and this lithium battery is having a years together of the operation. So lithium or solar battery will be there to running the machines for long time, at least 10 years without any electric supply. So don't worry about, my friends. If the electric supplies are not, no doubt electric supply facility will be there. But those who want to run without electric supply, there will be a solar battery or lithium battery incorporated. It will be easily movable by any person to anywhere in the OT and outside OT. So it is a very compact one. Now you see that these our MRI machines and CT scan machines also very handy, and that can be even wheeled to from one place to another place in the same hospital also. And friends, if you are tired and if you want to take anything in the OT with permission of your surgeons or OT manager, that you want to have a coffee, tea or juice, then vending machine will be there backside of this machine, and you can have a coffee or tea or juice, whatever you want to relax between anesthesia. Just now we have to go outside the OT and we have to take our all these drinks, but this is the facility. And believe me, all these type of the technologies are available in the airports and everywhere, in stations and whatever the things you can see personally. So suppose if you want to help your colleague distantly, then you have to go in the metaverse. And this metaverse is a very good technology integrated with these machines. And you have to wear the HoloLens or Microsoft Loop in your eyes, and you can reach by avatar to that theater where your anesthetists or friends are working, and you can see actually these working stations, my dream working stations, how it is, how it will be. This is just a photograph, but it will be a reality. You can operate from there, you can operate from your room. Physically you are at your hospital, but from virtually you are in the distance place. So this type of the technology, I don't see that it will not be done. It will be very near future, and it has started people have started things, but these are my dreams with reality. So ultimately my future anesthesia working station is like that. I have drawn this diagram that in 2030 switch on switch off anesthesia machines are viable. To kill the patients are very rare, and they will be integrated with his only one button, a sleep of awake or pending machines, and everything will be available. So in conclusion, my dream of future anesthesia workstation appears to be promising. With continued advancement in technology that enhance patient safety, provide better control of anesthesia delivery, and improve workflow efficiency for anesthesiologists. And you believe me, the closed loop anesthesia and a very advanced anesthesia gadgets, they will provide with this type of the working station with this. So it will be the best part. With the development of new monitoring system, everything, whatever the monitors you want in your these machines, it will be available. Like it will be having a depth anesthesia monitor or CO2 monitors, oxygen monitors, whatever you ask. And smart algorithm that can automatically adjust the anesthesia delivery. The anesthesia workstation will become even more sophisticated, precise, and efficient. The integration of remote access and telemedicine capability could allow for real-time monitoring of the patient undergoing anesthesia regardless of locations. So it becomes a tele-anesthesia or transcontinental anesthesia. From one continent to another continent we can. And it has become from Canada. Dr. Hammerling has given the anesthesia to the Italian anesthesiologist and Italian theater from their Montreal theater only. So transcontinental anesthesia is also has happened just 10 years back or 5 years back. I don't know remember the year, but now it will be reality. And advancement in machine learning, artificial intelligence, and metaverse also likely to be play significant role in the future of anesthesia workstation. With the increased use of automations and real-time monitoring, anesthesiologists will be able to focus more and more point patient care and less on monitoring equipment, and resulting in safer and more efficient anesthesia delivery. And probably the monitoring nowadays, you won't believe that I have read a news about Apple Watch, which will be integrated like a small monitor. In ICU, all monitors will go away, and patient have to wear only this Apple Watch, having all the multi-vital parameters like carbon dioxide, oxygen. Then see, this Apple Watch will be available within 1 year only, and they are having a facility for just now. They are having a facility of ECG, oxygen, blood pressure, pulse rate, and everything, and other parameters will be included in this. So it is also a reality within 1 year that all monitors will go away. So in theater also, just give the Apple Watch or multi-parameter watch to the patients, and everything will be seen in this your smartphone or distance any screen. So what is the take-home message? The field of anesthesia is evolving with the new technology, techniques, and medications emerging all the times. To stay updated in this dynamic field, it is important to keep dreaming, learning, and collaborating with innovation. As you continue your journey in the world of anesthesia, remember to prioritize patient safety and comfort. Stay informed about the latest developments and seek out opportunities for the professional growth and development. So you have to be updated. See, when smartphone came, we were not knowing that we were using the very old phone, and people have transformed that from within 10 years to simple mobile phone to smartphone. And even uneducated people or some less educated people have understood all the functions of this smartphone. So same like all the technicians, all the anesthesia caregiver have this type of the machine, very friendly user. So keep an open mind, stay curious, and never stop striving for excellence in your practice. With dedication, collaboration, and commitment to lifelong learning, we can continue to advance the field of anesthesia and even improve the outcomes for patients around the world with the future most advanced My Dream Anesthesia workstation. Again, I am repeating, to kill the patient under anesthesia, only because of anesthesia related reason, it will be a very difficult task. So this slide shows everything what I have told you. Size limited, just I am summarizing. Size limited to 5 feet, 3 feet, and 3 feet. It includes Wi-Fi, Bluetooth, artificial intelligence, metaverse, USB, different drug tanks, including all the anesthetic agent, inbuilt vaporizer, invasive monitoring with all multi-parameter monitors like NIBP, ECG, everything. And one knob for the all vitals. TCI machine vaporizer will be mounted. Only one screen for the ventilators. Inbuilt oxygen concentrator in case of oxygen failure. Only one screen touch knob in front of workstation. Workstation will be operated through remote. Also will be operated through the remote and smartphone. All parameters can be controlled in smartphone via Bluetooth, Wi-Fi, or metaverse. Lithium or solar battery will be there. It will be compatible with the MRI. You don't have to go another machine, pad, space situation, and movable by only one person. Only one tube for gas supply dedicated. All gas pipelines inbuilt in this with 70 liters of oxygen to be supplied. Eco-friendly scavenging system will be there for exhale gas. See, scavenging system is also going a tremendous changes. Instead of long pipe, the scavenging gases which are exhaled, they will be metabolized or it will be integrated in these machines only. So it will be an area. So green earth or green pollution, whatever you call it, will be not there. Even saline stand all corners of the workstation. So if your IV line is in where right or left, you can adjust on that. Includes phone dialing system for emergency, master reset button, easily serviceable, and feather touch operation. Facility for operated through verbal command also by metaverse, AI, or teleanesthesia. So my quote is, I like the dreams of future better than the history of past. I want to live with this type of the machine, and whenever I have this dream to be completed, I will be most happy. And these are my ideas only. But to tell you very frankly, it will be a reality within 10 years. All are big thank you for listening this type of the lectures. This is the first lecture I am giving in the world with this, and there are other 3 demands for these lectures in all over India within this week. So thank you, Dr. Pragnesh Bhai, Dr. Atul Bhai, and those who are listening on the YouTube channel. Thank you.
Thank you.
Thank you, Tushar Bhai. Atul Bhai, I got some questions on YouTube, so I think you would like to cover them.
Yeah, please.
I think rather than questions, there are some comments from Dr. Paul that first of all, it is a transparent machine, so it could be a source of distraction. That is number one. Then you talked about drug tanks. So there are problems of sterility and lifetime of drugs. Number 3, you're talking about N2O. I think it's an over thing now. And okay. Vaporizer for gases. It seems to be too complicated.
No, sir. Whatever my dreams will be completed because the engineers, this Apple Watch. I had given the example of Apple Watch. We were not thinking 5 years before that everything will be available on the Apple Watch. or Apple monitoring. All the monitor systems will be there. So there will be a invention in the anesthesia. Anesthesia is involving the invention field. So there will be a system. I don't know how it will work, but this will be there, and some modification will be there, no doubt it. But this will be there. You do not have to put the drugs will be tell you that propofol is blank or propofol is empty or propofol is less. So we can put a propofol from that, and no doubt about infection also. The infection, any anesthesia working station, whether it is today's working anesthesia station or whatever it is. Nowadays, all the OT will be like that, and I think the answer will be that it might be solved in the future.
Yes, and definitely. Can I add one thing? The nitrous point of view, in European country, they are now banned the nitrous because of the green OT. Second thing, definitely the Tushar dream thase kanke infection is a multiple option in the operation theatre, like
we can be controlled by this.
So we can control, and disposable things like syringes, infusion tank is cost, plastic material cost is comparatively too much, less.
Too much.
And
just you have to replace the tube, plastic tanks only. That's the reason I want to.
One more thing I want to add: in Draeger company, they have launched 1 crore rupees trolley, anesthesia trolley, more than 1 crore rupees. In Gujarat, they have only two. On Gujarat, they have only 2 models. But this model, just like nearby the Tushar based dream, like
I know that I have seen that sale.
Yes,
it is working with the Wi-Fi. They have got a Wi-Fi. So these machines are even controlled by the. See, I will give you the example of CCTV camera. If your hospital is having a CCTV camera, so that TV camera you can operate from your distant place, whether you are 1,000 miles are away or you can see all the things. So technology is now emerging, and this technology will be involved in our machines only.
Tushar bhai, Dr. Tushar, there is one more comment that if in between the surgery, Dr. Gandhi's wife called up and Dr. Gandhi is talking to on phone and that machine is verbally activated. It's a
it will be, see, in anything, the voice will be having its pet voice. We have to adjust the voice. Here, what happens, you know that in our smartphone, in my smartphone, if you tell from your voice, then it will not work.
Not working.
So same technology.
So one more thing I want to add, the Apple Watch.
See, Atul, I want to add. Atul,
yeah, please go ahead.
Voice activated command.
Yes.
This machine will remember individual name that Dr. Tushar Chokshi's voice is there. Then you have to first involve yourself in this operational level.
True.
The Apple Watch, they are now make a design, and within 3 to 4 months, they give diabetes control level. So continuous
I know
diabetes
that
glucose
monitor. With Dr. Pragnesh also.
So within a 2
even
or
you
3
can
months,
see blood glucose on this. So that's why I told you
without any pricking. Without pricking.
That's why Atul, I told you these monitors from the ICU will go away. Every patient will be given watch, and they will be adjusted by this computer only.
Pragnesh, છેલ્લે મારે એક announcement કરવી છે, if you do time permits.
Yes, please go ahead.
So now we conclude the session.
Yes.
So thank you, Tushar bhai. Now such a good, your dream is maybe 100% successful, and I think I want to just aware to the public, the doctors, that in 2000th century the anesthesia have a really the good command or good award because of the 20th century's invasion. That is for anesthesia. That's great achievement for us in anesthesia society. And within 15-20 years, we make a sudden change. So just like there's example like Tushar bhai says, there is the controversy in the death wing on table with no anesthesia machine or no anesthesia drug will cause directly to death because of multiple reason is there. That's why it's very, very definitely everything monitoring system is very good for the safety features. Thank you very much, Tushar bhai. I want to just announce in public also that we are in ISA Gujarat State Branch going to CPR aptitude for common people. So we are designed on the 2nd April 2023 in each medical college. Gujarat have 38 medical college. So we gain in almost all districts we are going for the CPR training system, CPR training to the common people. So please support us for this event, especially doctors. So they send their staff, they send their relatives, they send their family members. So CPR is must to the each and every person to know. This is not for the other people. This is for our health. Because if a cardiac arrest occurs me, Then if you are trained, you give me a CPR. That's my motto. So please, in 2nd April, we are going to with Gujarat government. Gujarat government already doing a GR on each medical college. And second, BJP doctor cell and others registration part. And we are taking leadership for the training of the all citizens of the India, and especially the Gujarat. So our target is 60,000. Yeah, our target is 60,000, more than 60,000 in one day in each medical college, simultaneously 8 to 6. So we already registered in the Guinness Book Record. The record is a subsidiary, but we are going focusedly 2nd April and 16th April. We are continuing this moment, and we request to government, Gujarat government, this is CPR in school level compulsory. And Gujarat is a model state for the India. So they are now agree. I have 2 meetings with CM sir and Patil sir and everything. So they agree, but they focus on the 2nd and 16th April. Then they decide what would go for this management. So thank you very much, Pragnesh bhai.
Thank you. Thank you, Dr. Gandhi, and thank you, Dr. Tushar Chokshi, for a very wonderful and interesting talk. And I must say, it was quite exciting to see the things are into the future. And as you rightly said, this will be a dream that will become true.
Yes.
And as you rightly said, this is not for anesthesiologists only. This will be a dream for all patients.
Every part of the machines.
This will be a boon for surgeons, patients, and everyone. Yes, so we are quite excited to have you today on Hitcon Hit Talk.
Thank you, sir.
Wherein we have good innovators and thinkers like you. So please stay connected with us. And on 28th of May, we are coming up with a physical Hitcon, a full day event of Hitcon in Surat. So I request all the viewers to join us there and keep us motivated. Thank you, Dr. Chokshi, and thank you, Dr. Atul Gandhi and ISA Gujarat for supporting this. Thank you.
Thank you.
Bye-bye.
Thank you very much. Thank you all.
Bye-bye.
Bye.